Hello, this is Xiaopeng from Kyushu University. Today we are going to have an interview about this paper. Okay, let's ask the first author, Dr. Minoda, to introduce himself.
So thank you very much. So I'm a Minoda. I'm belonging to Kyushu University Hospital. So today I want to talk and discuss about our article, especially in the measuring system for our impedance of GIST and non-GIST. Okay, please.
Well, in this paper, you mentioned that the target disease is submucosa tumor. What kind of clinical problems are you facing?
Okay, so we encounter gastric SELs in around 1% of screening cases. So the diagnosis of SEL is difficult with EUS imaging alone. So although EUS-FNA and FNB are considered the gold standard, but EUS-FNB is not only technically challenging but also requires special equipment. So for these reasons, it is not always possible to perform EUS-FNA and FNB at all facilities. So in addition, even if our FNB needle is inserted for such small SELs, it is often difficult to move the needle back and forth, so which leads sometimes difficulty of tissue acquisition. If a diagnosis cannot be made, the patient is recommended to be followed up. However, so there are many cases that drop out from this follow-up program. I think this is a very big problem in the clinical practice, especially for our small SELs.
I see. So how did you try to solve this problem this time?
So basically, in the clinical practice of SEL, the most important thing is to differentiate between GIST and non-GIST. In this study, we focused on the fact that GIST is a tumor with a higher cell density compared to leiomyoma or another SEL. We believe that the cell density could be used to differentiate GIST. To investigate cell density, we came up with the idea of measuring the electrical impedance of tumors. However, the question was whether we could bring this concept to the human in the clinical practice. So we decided to examine this series of studies.
Great idea. And what kind of device did you use?
So the device itself can be measured the tissue impedance that can be used in the basic research. The problem was how to combine this device with the EUS-FNB. In this condition, we focused the material of FNB needle. So fortunately, some of the FNB needle were made of material that conducts electricity as well. Even more fortunately, this material was continuously connected from the tip and needle to the end. Can you see it? So, yeah. So this is the top, the shape is a fork shape. And so this is connected to the tail of this metallic part. In this study, we connect this material part and with the clip and are connecting to our measuring system. So I think the very important point is to change the concept. So although needle have been thought of as a tool to take a sample in the past, so we change the concept and think of them as a measuring electrode that can be punctured. Yes, electrode. So this conceptual change was very important, I think.
Thank you. Your explanation is very clear. And I want to know, how did it work in the practice? Was it good?
Okay, so in this study, we found the electrical impedance can be used to be differentiated between GIST and non-GIST. To show this data, so now I will show the conceptual image here. We have conducted 3 steps of studies. First, we confirmed the impedance measuring system can really evaluate cell density at the measurement site in humans using a gastric neoplasia case. We did our first study. In the second step, we confirmed that the GIST has a high impedance value with exposed ACLs. Finally, we confirmed that the FNB needle itself is possible to use on electrode during the procedure of FNB. So, after puncturing the FNB needle, so we can easily check the impedance value, which suggests the cell density of tumor.
Okay, great. Do you think this time it is quite successful for future clinical use, or you want to improve that?
Thank you very much. So although there might be a room for improvement of this measuring system, so in this case, we are able to show that the concept is acceptable in this paper. So if device is developed more and more in the future, it could be used for other side, including pancreatic tumors, or sometimes we can easily use this FNB needle in a more easy method.
Okay, sounds promising. I hope it works better in the future.
Thank you very much. So to overview the endoscopic treatment for SCLs, many endoscopists have developed the technique of full thickness resection. On the other hand, if only endoscopic treatment advances too rapidly, the importance of diagnosis is sometimes dismissed. So although changing the needle from FNA to FNB, so the diagnostic method for ACLs have been advancing gradually in recent years. So, but we have to advance diagnostic techniques more strongly. We have to improve the diagnostic yield, especially for small ACLs.
Oh, great. I really look forward to your next step. And hopefully I can use that in bedside soon. Thank you.
Thank you very much.